guys, welcome back to Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular. Today we're going to talk about vascular disease in athletes. If you've been following along, a lot of what we talk about is, okay, well you have plaque from eating a bad diet or maybe smoking or family history or aneurysms. Now we're talking about athletes. So these are young, otherwise healthy people, not really the population that we think about for typical vascular diseases. However, these situations do come up. Diagnosis can actually be pretty challenging. And oftentimes, we as vascular surgeons are often the last people to become involved because this is not generally what we would think of first in maybe an otherwise healthy 25-year-old runner or a professional cyclist or a collegiate baseball or volleyball player, for instance. There's just a few conditions. I don't intend for this to be a comprehensive lecture, but a few conditions I just want to mention. The first one is called compartment syndrome. Compartment syndrome is something that comes up in the kind of more urgent setting after trauma, after some vascular operations, if we're restoring blood flow to a leg, for instance. You can also have chronic exertional compartment syndrome, which essentially occurs because our muscles are all encased, or kind of throughout our body, our tissues are encased in what we call a fascia, which is this very tough material, but it's essentially what holds our shape together. It's what keeps our muscles within their compartments. And so if you have a fascial compartment that is too small for the muscle within, whether the muscle has become inflamed and is swelling, maybe you just have hypertrophy of that muscle that has happened faster than this fascia can expand to allow. Essentially what can happen though is you can get pain and actually destruction of the muscle tissue, damage to nerves and vessels that are also contained within that fascial compartment. Then the treatment involves opening up that fascia to allow the muscle room to expand. Thoracic Outlet Syndrome is something else I want to mention. As it pertains to athletes, we tend to see Thoracic Outlet Syndrome come up in people that participate in overhead throwing sports or sports where there's a lot of overhead activity. So think about volleyball players, baseball players, pitchers especially, a lot of overhead lifting, and due to muscular hypertrophy around the base of the neck, the shoulder, under the collarbone, what happens is we get compression of the structures that pass through the thoracic outlet. So this is the space created by the collarbone, the first rib deep inside, and some connecting muscles underneath called the scalene muscles. We can have damage that occurs to the vein, irritation and damage that can occur to the brachial plexus nerves, and although also the artery, that tends to be a little more rare. The treatment for thoracic outlet syndrome, of course, is specific to the patient and the problem, whether it's a nerve problem or a vein problem, but in general, the common theme is all of these structures are tightly packed in between these collarbone and the first rib, and so we have to open up that space. And so typically the treatment is removing the first rib. The first rib is deep inside. You can't feel it. You probably never thought about it being there, and it's not something that is going to cause us a functional change by removing it. And so what we see is people that are affected by thoracic outlet syndrome after decompression surgery with removal of that rib, people return to the same level of activity almost universally. So this might mean taking a short break from your professional sports career, but then returning back to your professional sports. So the important thing is this is not necessarily a career-altering condition, but something rather that can be treated effectively and then allow you to get back to whether it's your hobby or your career, either one. Popliteal Entrapment Syndrome, it falls into a slightly different category. It's really more of an anatomic condition, meaning it has to do with the structure and the relationship of your calf muscles, your gastrocnemius muscles, and your popliteal artery. So this is something that actually people are born with. How and when and if it becomes a problem has to do with the particular anatomy and also the particular activity. So sometimes we find popliteal entrapment syndrome just by accident, and part of the gastrocnemius muscle, the calf muscle, is wrapping around the vessel and just pulling it to the side, slightly outside where we would normally expect to find it. Sometimes that might mean the muscle is completely compressing the artery, causing it to become completely blocked. More often when this comes up in otherwise young, healthy people, especially athletes, is it might be someone, let's say a runner, for instance, who's out running and maybe a competitive runner doing 5Ks, 10Ks, marathons, what have you, and all of a sudden they start to get claudication, which means pain with exertion. It might only be felt when they're out running at a 6-7 minute mile pace, but for that person, it's still abnormal. And so then we have to start looking for these less common problems, and that might mean popliteal entrapment. And the treatment, again, is tailored to the patient and the particular anatomy, but a lot of times it might mean going in and just removing part of that muscle, preserving the bulk of the muscle so there's no functional change, or sometimes it means actually having to move the vessel or create a new vessel with a bypass. The last one I'm going to mention is called external iliac endofibrosis. This one is rare. This tends to be something we specifically see in very high level cyclists. And so what happens is the external iliac artery, which is essentially the last part of the iliac artery as we travel from the belly and the pelvis down into the legs, that vessel passes right on top of some muscles that are important for our posture and standing and moving, in our hip supporting muscles. But in particular, these muscles are involved with cycling, especially when you're in a really aggressive cycling position. And if you think about the repetitive motion, every time you pedal, these muscles are going to be flexing and contracting and interacting with those vessels, cycling hundreds of miles per week. You're talking about thousands and thousands of repetitions. The vessel can actually get so inflamed that it will start to narrow on the inside. People will start to get claudication and pain with cycling. It might be that they only get pain when they're 2 hours into a bike ride, but if the normal is that, well, I get on my bike and I bike for 8 hours and I never stop because I'm a professional, but now I can only go for 2 hours, it's a big difference. The way external iliac endofibrosis is treated is actually by going and surgically removing this scar tissue that builds up inside the vessel. Vascular disease can affect anybody. So if you're getting pain in your leg that really can't be explained, you're not getting the answers that you're looking for, the orthopedics say everything's fine, maybe it's time to consider getting your blood flow checked, get your arteries checked, get your veins checked, because sometimes vascular conditions can present in unique ways that maybe we don't think of as the first problem. Thanks for tuning into Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular.
Thank you.